I think that our hospital system, and I think most hospital systems around the country, see spiritual caregivers and family caregivers as essential, even in this time. I think that a lot of hospitals right now, if you just go on the internet and look, have a no visitation policy, and that's actually true for most adult hospitals. No visitors allowed really at all. Um, but their pediatric hospitals like mine oftentimes have a clause or an exception that says, these are children and children shouldn't be in a room by themselves. And so we'll allow one caregiver to room in with the patient. And so that's one sort of exception that we've made for kids, is to say, there's a family member or guardian should be in there with the child, because we understand, again, with children's health care, that it's very different, and that the kids really need their parents to do things like eat and get dressed and really thrive as an individual. So there's this community aspect of pediatric care that I think is a lot of times missing in adult care. And honestly, if I think about it long enough as a psychosocial provider, I think, well, maybe we should allow one room in caregiver even in adult hospitals. But then we're doubling basically the population of a hospital by doing that, and that again raises some public health concerns. Um, the other thing I will say is that we do have exceptions. Besides just the pediatric exception, there's end of life exceptions that we have. And those exceptions are basically saying when we think a patient is dying, we are going to allow more people to come in and see them than we would if the patient were in a routine hospitalization. And so what we have done is created a policy that says we're going to let people go in small groups for short periods of time, family members, to go see the patient. The other thing is, for a period of time in our hospital system, we didn't have chaplains going into the room. They were all doing televisits. And part of a policy group that I was on recently, we said, this is really unacceptable. We need to have chaplains and potentially soon child life specialists come in and be able to be with patients and families at the end of life. And so we actually have gone through the process of getting all of our chaplains fit tested, which is making sure that the mask fits them correctly, the N95 mask, and allowing them some time to spend with patients, especially at the end of life. And so I would say that our system has really seen families and spiritual caregivers as essential. And we've also made exceptions for outside pastors to come in and visit patients at the end of life as well, on special request. And so I think acknowledging that as essential is really an important part in this pandemic.